What's up, guys? We're going to talk about why general dentists struggle so much to offer clear aligners to their patients and their practices. I've talked to all my students, and these are the 5 most common reasons why they said that they never started doing aligners before they started working with me. So in this video, we're going to dive into these reasons, and I'm going to help walk you through them and see how are some ways that you can actually come out ahead instead of making excuses and not doing this procedure. So let's start off with the education piece. When us dentists went to dental school, ortho was not a specialty that was really taught to us. I remember for me, when I went to NYU, they didn't even teach us anything other than how to identify cases that we need to write out a referral form for. That's it. We didn't bend wires. We didn't place brackets on typodonts. We didn't do any of that stuff. We did, however, get certified to do Invisalign. Now, this sounds cool, but in reality, it sucked. That class was just a bunch of modules that we pretty much clicked through, and we would have to spend an hour a week in the lab hearing the professor lecture us on this procedure. And then if we wanted to implement it, we had to set up time with one faculty who was allowed to do Invisalign cases with us. And we could only schedule time when that one faculty member was in the clinic. So imagine if you have a patient who wants to get Invisalign done and you're in dental school and you're super excited to do this treatment with them, and you try to schedule them within a 3-hour window so that way that faculty member can be there, and then you bring the patient into that 3-hour window to do the process, and then the faculty member is not even there. That's what happened to me when I tried to do an Invisalign case in dental school. So after that point, I needed to get my degree, so I had to focus on these other things. Invisalign was kind of like this extra thing on the top, so I figured, hey, I'll put this on the back burner and maybe I'll learn this when I get out of school. So then I graduated and I'm Invisalign certified, but I had no idea how to actually do Invisalign. So since I didn't know how to actually do it, I didn't offer it. And I know I'm not alone. You're watching this video because you're clearly trying to learn about aligners, and I bet you don't know how to do it either. After a couple years, I got the courage to invest in myself and learn about aligners, and now I've actually created a resource where I help train dentists how to do it. You can check out the free masterclass that I've created for dentists teaching them how to do aligners. It's in the description below, but let's get back to the story. So one of the reasons why dentists don't offer aligners is because of the lack of education and training. What works directly with that is this fear of the unknown. Anytime general dentists offer a new procedure, they're usually really excited, but they're also super scared. That's okay. You're scared because you care. You don't want to cause harm to a patient. That's totally normal to think like that. But you can't let this fear stop you from growth. When you are afraid of something and you avoid doing it, you are shooting yourself in the foot, because on the other side of that fear is actually a bunch of opportunity. So what you have to do is you have to find a way to get over that fear. And if your fear is from lack of education, well, go out and get the education that you need so that way you can have the confidence to offer this procedure. This isn't just with aligners. This is with anything. Another reason why general dentists struggle to offer aligners is because of a costly time and financial investment that it takes to implement this procedure. Now, I always say, if you're going to do aligners, you have to be in a practice that has a scanner. If you don't have a scanner, you are not going to be successful with this procedure. Scanners are usually around like $30,000, and I know that's not cheap, but what it's going to do is it's going to help you have so much efficiency so that when you get your cases rolling, you can scale this thing and you won't even look back. $30,000 is the equivalent of 6 cases. Each case sells for $5,000. And guess what? If you can do 6 cases, you can do way more. So you're not going to be stopping there. And now all of a sudden you've paid for the scanner and you're making more money than you could have ever imagined. It's a no-brainer. Another financial investment that dentists think they have to do is they have to market about this new procedure. You don't have to market for this new procedure. The only form of marketing you need to do is start opening your mouth. Start talking to your patients about it. It's free marketing. You don't need to pay and get all these leads on Facebook or Instagram. I mean, you can if you want to, but you don't have to. When I first started doing aligners, I did 50 cases in my first 6 months, and I didn't run ads. I was an associate. I started opening my mouth and educating my patients, and I got them to commit to treatment because they understood the value in it. So stop making excuses as to why you can't start, and start doing things to make it happen. Another reason why general dentists struggle to offer aligners is because they're afraid of the legal issues that come with offering a new procedure. So liability is a big thing in dentistry, and I totally get it. But if you're educating your patients and you're getting consent for the treatment and you're operating from a good place to help improve your patient's oral health, you're gonna be fine. Don't let this be another reason why you can't start start something new. And the last reason why general dentists struggle to offer aligners is because they don't think they have the patient demand. The thing is your patients are not going to be busting down the door telling you, I want aligners, I want to straighten my teeth, I want to look beautiful, I want to have a better smile. It's on you as the dentist to educate them as to why aligners can help improve their oral health. When you take that angle, you will see a lot more patients will start saying yes to treatment. Don't get hung up on the cosmetics. Chances are you don't have a cosmetic practice. You probably work in a place that takes insurance. Patients want to do the bare minimum. They're going to question you if you do fluoride because they want to know how much that costs. And all your patients just pretty much want everything for free, right? They think if they pay $15 a month for their dental insurance, that's going to cover all the treatment that they need. You see how if you get sucked into that mentality, you end up doing nothing? You have to take control of the situation. Educate your patients why they need something, and then be able to do that procedure with confidence. So now you know why general dentists struggle to offer aligners. I hope that you got some type of awareness from this video. And if you enjoyed this video, please don't forget, drill that like and subscribe button. But more importantly, share this with a dental colleague. You can also follow me on Instagram at dr.avi. I share clear aligner videos every single day, and you will also find some daily motivation videos for dentists. Thanks again for watching. I'll see you in the next video.